Good morning to everyone. My topic is prevalence of refractive error and amblyopia and their association in a 5 to 15-year-old children. Introduction. Amblyopia is defined as a reduction of base corrected visual acuity of one or both eyes that can't be attributed exclusively to a structural abnormality of the eye. Amblyopia results from abnormal development of the visual system in early childhood. The visual cortex needs continuous, clear and focused visual impulses to develop normally. Children with amblyogenic risk factors, if not treated, are vulnerable to functional reduction of visual acuity causing amblyopia. Non-predisposing risk factor for amblyopia are strabismus, refractive errors, particularly anisometropia and high hyperopia, and visual deprivation such as a ptosis and a congenital cataract. Purpose of the study is to assess the prevalence of amblyopia among the 5 to 15-year-old children and to analyze the association between the type of refractive error and amblyopia. Material and method. A retrospective medical record review of the children between 5 to 15 years of age was carried out in Shivsa Medical College and Hospital, Gujarat. Duration period from August 2020 to July 2021. Inclusion criteria are all the children between 5 to 15 years of age group are included. Exclusion criteria are the children less than 5 years and greater than 15 years of age, history of a premature birth, presence of the developmental delay or the neurological disease, presence of a systemic disease or a presence of any non-eye disease were excluded. Then material and method. All the children diagnosed with the refractive error were underwent the detailed ophthalmic examination. Examination included corrected and uncorrected visual acuity, external examination, direct ophthalmoscopy, cover test at far and near, cycloplegic, non-cycloplegic and the subjective refractions. The diagnostic endpoint was a base corrected visual acuity of the less than 6/9 or a 2-line interocular optotype acuity difference. Chi-square test was done for the statistical analysis. Then results. In our study, 2,741 children were included in study. Out of them, 93 children were found to have amblyopia, and out of 93 children, 31 has the uniocular amblyopia, and the 62 children has the binocular amblyopia. So the binocular amblyopia was more than the unilateral amblyopia. Then age and gender-wise distribution of patient according to the amblyopia. We have found the no gender independent of gender, equal in male and female. Then average age of presentation was 11.15 plus or minus 2.78 years. Visual acuity in a amblyopic eye. We have found it that the most of the children has a visual acuity between 618 to 616. Then association of refractive error and amblyopia. In our study, astigmatism was found more, then followed by the myopic astigmatism, hypermetropic astigmatism, then myopia, then hypermetropia. Discussion. The prevalence of amblyopia in our study was 3.39%, which is comparable to other studies. Prevalence of refractive error was 23.20%. Patient with visual acuity between 618 to 660 have the higher degree of the amblyopia. Result from the study clearly depicts that the amblyopia was independent of gender. Myopic astigmatism was most common in amblyopic eyes. Therefore, the uncorrected refractive error was commonly associated with the amblyopia. In conclusion, as per the finding of our study, refractive error is a major risk factor for the amblyopia. Therefore, it emphasizes the need for visual screening of young children and management of refractive amblyopia at appropriate time. Thank you, sir.
Now, why do you think myopic astigmatism was the main cause of amblyopia?
No, ma'am. Astigmatism and refractive error are all are the.
In your study, myopic astigmatism you've written, no? 58%, something like that. 50 plus.
Myopic astigmatism are found more.
Why?
In general, refractive error are more associated with amblyopia.
What is your study?
Uncorrected refractive error.
Is there any explanation for myopic astigmatism causing more amblyopia? Did you find any?
Because children age group are the more vulnerable to myopic refractive error.
What did you take as the criteria for monocular amblyopia and binocular amblyopia?
Visual acuity, Snellen chart difference. Visual acuity 6.6 is in a fellow eye. Then we included that is the uniocular amblyopia.
6.6 and 6.9 will be uniocular amblyopia.
Less than 6.9 or 6.6.
And binocular?
For binocular, less than 6.9 or in both eye, 6.9 to 6.12.
What can be the other causes of amblyopia in this age group other than refractive error?
Any congenital ptosis or cataract or strabismus or any meridional amblyopia.